Welcome again, everybody, to a new session of the radiographic interpretation of 3D. And in this session, we're going to talk about the radiographic interpretation of the condyle of the TM, which is one mandibular condyle, which is one of the important components in the temporal mandibular joint complex. As we all know that the CBCT displays the hard structures, bone, and it does not have the ability to demonstrate the soft tissues in any part, except that we will see a gray appearance of the thick tissues, but without any clear demarcation of the type of that tissue. Anyways, so if we will start with this patient, we will drag our slicing window. So what we will do is that we will drag our slicing window to the condyle with the right condyle. This is the this is the right condyle, and we will try to locate the condyle in the center. So when we try to, at the center of the condylar head, you will see that in the tangential view, the condyle is in the center. I'll drag it to in the center. Here, in the coronal view, I will drag it again to the central part of the condyle, and this is, that because this is 2D, this is 2D in a coronal view, and this is the top view of the condyle. Again, I'll try to keep all the cursors across in the center. Okay, let us start with the sagittal view. And the sagittal view, as you know, I'll try to minimize. When I move in the sagittal view, when I'm moving in the sagittal view, what is happening is that I'm seeing the objects in a medial-lateral direction. Now here I'm going to the most medial part of the condyle. I can trace it on the other views, and then I will drag it again with the mouse, with the left click on the mouse, and then I will try, what I'm going here is I'm trying to the farthest part, which is on the lateral side. So to maximize again, okay, I'll remove the spin so that you will be able to more locate, and we will try to magnify the image. What we will see here is that we will see the condylar head, okay, and this is the condylar head over here, and this is the superior part of the condylar head. This is the medial part of the condylar head. This is the beak, bird's beak of the condyle, and this is the lateral surface of the condyle, okay, of the condylar head. This is the articular eminence of the temporal bone, and this is the articular fossa of the temporal bone. As you can see here, we end up with the petrous with the mastoid process. Okay, this space is occupied by the disc, its anterior part and the posterior part of the disc, plus the of course it doesn't show here because of the, as we said, it's a soft tissue, and this is not a CT, this is a cone beam CT, so you don't expect to see it. What you see is a grayish area, which represents a combination of the superimposition of the soft tissue structures here, the disc and the medial lateral pterygoid muscle, the frontalis muscle, all here connected to the condylar head, so you don't see them all. Anyways, what we are concerned about is the integrity of the condylar head. Don't be satisfied with a single view of the condyle or a single slice. Try to navigate through all the thicknesses or all the slices of the condylar head in a medial-lateral direction. Okay, in a medial-lateral direction. What do we expect to see in a normal condylar head, or what would you be looking for? First of all, you will be looking at the superior surface of the condyle plus the lateral and the medial surfaces. What you want to see here is that you want to see any roughness, irregularity in the surface, or pitting and or osteophytes. That is bony projections from the condylar head. So what we look is for the surface integrity. It should be smooth all around in all the slices and all the image thicknesses, because we don't, when we see here, when we see an image here, actually we are not seeing the whole condyle. What we are seeing is only part of it. Now I want you to have a look on this area, which is, it looks to be as if it is a discontinuity in the condylar head. What you need to do here, if you want to verify, I will just locate this area, okay, drag it, and then I will try to have a look on the other structures. Is it a depression? Let me have a look at the coronal part. Okay, let me move, and here I'm moving anterior posteriorly. Actually there is no area of irregularity here, because it is a superimposition of the superimposition of the structures that overlay this area. How do I know? I'll try to maximize again. Now have a look here. This line is extending, actually is an extension from here to this area. See it over here? So what you're seeing here actually is a superimposition that lays its shadow, which gives a wrong impression that there is a discontinuity or pitting in the posterior surface of the condyle, in the posterior lateral surface of the condyle. So again, see this line, it is continuous. I will just go over here. See this line? So it is a continuity. Again, let us go back to the surface integrity. This condyle seems to be in a good condition. Okay, I mean here there is no pitting, no flattening, okay, or erosion, no osteophyte formation. After you're done with this, you will have a look at the articular surface of the temporal bone. You will look for the same criteria that you were looking here. One is the integrity of the surface, no pitting, no erosion, and the space. If you go to the both sides, we can measure this. I just want to confirm we can measure this area from the superior surface to the maximum depth of fossa, articular fossa, sorry, in the temporal bone. This is 6.7 millimeter. This, in the normal cases, should be equal plus minus few millimeters on the other side. It means that there is no dislocation or improper position or unequal position of the condyle on either side. Okay, what you are interested in also is you want to see this curvature of the condyle or convexity in articular fossa over here. We don't want to see flattening, okay, and we don't want to see extra bone deposition in here. This happens usually in cases of osteoarthritic changes where there is flattening, and which is compensated by bone deposition on this area. And at the same time, we want to see this space because this is occupied by soft tissue. Okay, if this space does not exist, it means that we have ankylosed condylar head to the temporal bone. Of course, this happens in different different degrees depending on when the radiograph was taken and the severity of. In the sagittal, in the coronal view is the same criteria is followed, but you will see here that the condylar head in its appearance is different. See, this is the typical appearance of the condylar head. This is the ramus of the mandible, okay, and then this is the condylar head of the mandible. We will search for the same criteria. What we're doing here is that we are moving in an anterior posterior direction. So we will once we have the chance to navigate, we will have to navigate from its most anterior posterior part to its most anterior part, so that we will not miss any image slice or thickness in the condyle. Again, you will be looking for the integrity of the condylar head of the surface articular surface of the condylar head. A normal condylar head will be smooth, no pitting, no irregularities, no cysts or pseudocysts, no flattening, okay? And this space, which is occupied by the disc, this is a cut through in the anterior part of the disc. It should be again equal if you measure it from the articular fossa down to the condylar surface. It should be equal on either side of the condyle, so we are sure that there is no imbalance in between the position of the two condylar heads. Just like when we were in the lateral view, the same criteria are followed, but in an anterior location. Okay. The last view to look at is the superior surface, or the axial view. This is the view from the top. I'll try to drag this away because I cannot move it, and then I will start to I can't remove this in this view, and then I will start from the very top of the condyle. This is the top of the condyle over here. I'll just take you back again. This is the top of the superior surface of the condyle. See it on the other views over here. And then I will try to move in a downward direction. See, I'm moving down, down, down. What I'm seeing here is actually I'm seeing the condyle from the top in a superior inferior direction. Now the condyle here is over. I started with the ramus of the mandible. I'm looking here, by the way, and then I will end up with the ramus. Again, I will try to drag the image up, 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 okay? And I will try to view the condyle. I'm viewing the right condyle, as you can see in here, in the in all image slices, looking for the same criteria. That is the integrity of the walls over here, no pitting, no erosions or radiolucencies over here, no imbalance in position between the right and the left condyles, and if there is any case of trauma, of course, naturally this will be dragged in this direction, medially and more anteriorly. And typically the fracture site will be in here, over here. Okay, so this is the posterior process of the articular fossa. Okay, and it should again be just like with the condylar surface, all the same criteria, equal distances, homogeneous distances, no pitting, no erosions, no osteophytes. These are or bony projections or bone spikes. All these areas should be the same. If you see anything else, like we will see in the future on the interpretation of the TM joint disease, we will see that either all these criteria is present or one of them. It could be either one or more of them, and it could be either seen in a single, unilateral or bilateral, so it depends according to the condition. Here, if we will see discontinuity, if we will see pitting, if we will see roughness, osteophytes, pseudocysts or radiolucencies in any surface of the condyle, then or we will see reduction or unequal distances between the condylar head and the articular surface, then we will suspect, or we will investigate more into the condition, and then we will try to know the disease. Of course, all these are purely radiographical signs, radiological signs. We cannot build anything like what the patient feels, or what are the signs and symptoms. These are all for the patient to tell, and for the examination to be for detailed clinical examination. However, if we are interested or we want to investigate the soft tissues in this area, whether the muscles or the cartilaginous discs or with its attachments, then we should think of either MRI or the CT scan. Both of these will give us a 3D representation of the soft tissues. One is is not invasive. The MRI has no radiation, while the other one is invasive radiation, in which there is a great dose of radiation if it is compared to the cone beam CT.